Hey, hi everyone. Welcome to our YouTube channel. Today we are here to answer the Google's most asked question on diabetes. Are you all ready? So let me start with the first question. So here comes the first question. It says, what is diabetes and how can I be tested for it? Well, so diabetes is a chronic condition which is actually because either your pancreas is not able to produce sufficient insulin or the insulin that is being produced is not being utilized properly. Because of which, when you test your sugars, the glucose will be revolving in your bloodstream and because of which you get to know that you have diabetes. Now, what tests to be done? There are multiple tests, like one, for example, fasting sugars. You can get your oral glucose tolerance test. We can also get your glycosylated hemoglobin A1C test, random blood test sugars. It's very important to consult your healthcare professional if you have diabetes or you have the risk of developing diabetes, so that they can tell you what is an appropriate test for you to be diagnosed. So let's go to the second one. Okay. It says, what health problems does diabetes cause? So when we say diabetes, it can cause a lot of problems if it is not being managed well. It can lead to short-term and long-term complications. The short-term and the long-term complications, like say for example, it can lead to cardiac problems, it can lead to heart disease, it can lead to stroke, it can damage our kidney, it can cause eye problems, skin irritation, it can lead to gastric-related issues, food problems, and it just hampers everything. So it's very important to take a control on it. Moving on to the next question. What type of diabetes am I at risk for? Well, the risk factor for diabetes include if there is any family history, a genetic predisposition, and if your age is above 45 years, the risk is high. And if in case, if we are not maintaining a good health with respect to diet, if we are taking a lot of processed food, sugary beverages, yes, and apart from this, if we don't maintain an ideal body weight, it is also an increased risk factor. And especially for women, if we already have a history of polycystic ovarian syndrome, then the risk of developing type 2 is really high. Let's move on to the next question. Can I reverse my diabetes? Well, when we talk about diabetes, we need to understand what type of diabetes that one is being diagnosed with. If it is a type 1 diabetes, we call this as an autoimmune disorder, and your pancreas or probably your immunity cells attack its own healthy cells and your pancreas are not able to produce insulin. And the only way to treat this is to be giving insulin to the person for lifelong. So, type 1 cannot be reversed. So the other type of diabetes is type 2 diabetes. Now, it's a condition where your body is able to make insulin, but for some reason it's not being utilized. And this can be actually made working if in case, if you change your lifestyle. When we talk about, appropriate medical interventions, of course, it's very much important. And definitely we can reverse it if it's been diagnosed at a very early stage. So let's move on to the next question. What can I do to prevent diabetes? To prevent diabetes, something that is very, very important is one, to have a healthy diet, and that is something that we need to focus on. It's just not the diet alone, we also need to focus on good regular physical activity. The reason why we need to focus on all of this, because it directly has an impact on our weight, and maintaining the weight is also one of the important factor in preventing diabetes. Now, apart from this, as we all understand that we need to avoid sugary food, probably beverages, ultra processed foods, managing stress, of course, very, very important, prioritizing your sleep, and more importantly, the quality of the sleep, and also very important to quit smoking. And if there is already a family history of diabetes, it becomes even more important to go for a regular health checkup, so that if there is a risk factor, you know what needs to be done to prevent it. So let's go to the last question here. Okay. What type of foods should I be eating to control my blood sugar levels? To control your sugar levels, first thing what we generally advise is to focus on whole grains, fiber-rich foods, which is very, very important. If you are a non-vegetarian, probably look for a lean protein. Again, when it comes to the fat always needs to be taken in moderation. Again, portion control is something that is always recommended. Definitely stay away from sugar as much as possible. Stay hydrated, maintain and have a balanced meal, and also monitor your sugars on a regular basis to know whether it's working for you or not. So these were the 6 questions. Hope my answers were helpful. We'll be seeing you in the next video. Thank you.